In a breathing emergency, a person's respiratory function can become so impaired that life is threatened. Breathing emergencies are progressive. If the person does not receive care quickly, their respiratory function will become increasingly worse. Respiratory distress, or increased work of breathing, is the earliest stage of a breathing emergency. Many conditions can cause respiratory distress. For example, a person experiencing an asthma attack, a severe allergic reaction, a heart attack, or a panic attack may have respiratory distress. If not treated, respiratory distress can progress to respiratory failure. In respiratory failure, the respiratory system is beginning to shut down. There may be some ventilation, but it is not effective, and as a result, the blood contains too little oxygen, too much carbon dioxide, or both. If respiratory failure is not relieved, respiratory arrest can occur. In respiratory arrest, breathing stops. Cardiac arrest will soon follow unless respiratory function is restored. You can identify a breathing emergency by watching and listening to the person's breathing and by asking them how they feel. The person's breathing may be slower or faster than normal, or unusually deep or shallow. It may be difficult for the person to speak in full sentences. You may hear gasping, wheezing, gurgling, or high-pitched noises. The person may tell you that they feel short of breath. In a child, you may also see widening of the nostrils when breathing in, use of the chest and neck muscles to assist with breathing, and grunting. The person's general appearance may also give you clues that they are experiencing a breathing emergency. The person may lean forward with the hands supported on their thighs or another surface to make breathing easier. This is called tripod positioning. The person's skin may be cool and clammy, and it may appear flushed, pale, gray, or bluish. The person may be irritable, restless, or anxious. There may be changes in the person's level of consciousness. You do not need to know the exact cause of the breathing emergency to provide initial care.
Hi, I'm Joe. I'm a certified lifeguard. Are you okay?
When a person is having difficulty breathing, activate the EAP
Call 911, get the equipment,
and instruct someone to call 911 and get the emergency equipment. Then, encourage the person to rest in a comfortable position that makes breathing easier, such as sitting up and leaning slightly forward. Provide reassurance, which can reduce anxiety and make breathing easier. Offer to assist the person with any medication they may carry with them for the emergency treatment of a condition such as asthma or anaphylaxis. Administer supplemental oxygen, if it is available and you are trained to do so. Monitor the person for changes in their level of consciousness and breathing, and be prepared to provide care for respiratory failure or arrest and for cardiac arrest.